The Spider FX is designed to give the physician maximum choice throughout the intervention. This filter embolic protection device allows the physician to cross the lesion with their preferred guide wire. The filter comes in 5 different sizes to accommodate peripheral, coronary, and carotid interventions. The Rapid Exchange Spider FX catheter is designed for easy deployment and recovery of the Spider FX filter. The nitinol braided Spider FX filter and flexible hypotube connector are designed for conformance and vessel wall apposition, even in tortuous locations. All components of the system are provided in a single sterile carrying hoop. The capture wire comes preloaded into the green delivery end of the Spider FX catheter. A flushing needle is included on the hoop for easy device preparation. Beginning at the white distal tip of the delivery end of the catheter and proceeding proximally, the catheter features a marked Rapid Exchange primary wire exit port, a clear segment to hold the filter during primary guide wire loading and advancement, an exit port where the capture wire exits the proximal portion of the delivery end of the catheter, and a blue recovery end of the catheter. Use your preferred 014 or 018 guide wire to access and cross the lesion. Perform angiography to visualize the lesion and measure the vessel diameter, approximately 3 centimeters distal to the edge of the lesion. Ensure there is sufficient vessel clearance beyond the lesion to accommodate the filter and distal tip. Use the sizing guide in the instructions for use to select the appropriate diameter Spider FX system and to ensure device compatibility throughout the intervention. The Spider FX is available for use on any preferred 014 or 018-inch guide wire. The Spider FX device fits guides or sheaths with a minimum ID of 0.66 This capture wire is now available in a long snap wire or a shorter rapid exchange length. In a sterile work area, remove the Spider FX packaging and detach the colored portion of the hoop to expose the filter and delivery end of the catheter. Grasp the catheter near the primary wire exit port to provide adequate support when handling the device. If you are using the long snap wire version, the capture wire may be snapped to create a rapid exchange system at this time. Using a dry gauze to support the distal end, hold the catheter and submerge only the filter in sterile heparinized saline. Gently pull the filter completely into the clear segment until it reaches the automatic stop. Do not grip the white distal tip directly. To ensure proper flushing, gently press a finger against the primary wire port to block it. Using a syringe and the prepackaged blunt end needle, flush the distal tip of the delivery end with sterile heparinized saline. Flush until fluid passes out the capture wire exit port and all air is removed from the catheter. First, locate the primary wire exit port by the white mark on the delivery end of the catheter. Load the delivery end of the catheter onto the primary wire and gently advance until the primary wire proximal end is 1 to 2 centimeters distal to the exit port. To aid in proper primary guide wire exit, form a gentle curve in the catheter over your finger, with the primary guide wire exit port at or near the apex of the curve. Advance the catheter to allow the wire to exit through the port. If the primary wire bypasses the exit port into the clear segment, stop and pull the catheter back, as this could cause device damage. Realign and re-advance so the wire exits properly. Clearly identify the primary wire from the capture wire and continue advancing the Spider FX catheter over the primary wire and into the guide catheter. Advance the capture wire and catheter as a single unit while keeping the primary wire stationary. Using fluoroscopy, advance the catheter until the catheter distal radiopaque marker is at least 4 to 5 centimeters beyond the distal edge of the lesion. Stabilize the Spider FX catheter and gently remove the primary guide wire. The Spider FX capture wire is the working wire for the remainder of the interventional procedure. While keeping the catheter stationary, advance the capture wire until the radiopaque distal filter marker aligns with the distal radiopaque marker band on the catheter. The filter distal tip may be observed extending out of the catheter. Adjust the position of the capture wire and catheter as a unit, placing the proximal radiopaque marker of the filter at least 2 centimeters past the distal edge of the lesion. This should provide sufficient distance for the interventional device. Stabilize the capture wire and gently withdraw the Spider FX catheter proximally to expose the filter. Before removing the catheter, ensure the filter proximal marker is at least 2 centimeters beyond the lesion and the filter radiopaque gold marker has fully opened. The filter should oppose the vessel wall. Do not place a Spider FX device in a vessel that does not allow wire movement. This could lead to embolization of debris and vessel and/or device damage. If the filter needs to be repositioned, advance the Spider FX catheter to collapse and enclose the filter within the catheter. Then move the capture wire and catheter as a unit to the desired location. Do not attempt to move the filter without first advancing the Spider FX catheter to collapse and enclose the filter. Doing so could dislodge debris and cause vessel and/or device damage. Once the filter is deployed and position is confirmed, stabilize the capture wire and remove the Spider FX catheter by gently pulling the catheter proximally. The blue end of the catheter is used for recovering the Spider FX filter. Do not discard this catheter. Proceed with the intervention, using the Spider FX capture wire as the device wire. The Spider FX filter may remain in place for up to 60 minutes. Check filter patency and position frequently, observing for the occurrence of possible obstruction or slow or no-flow conditions. If removal of the filter is necessary, use the recovery end of the catheter. Retrieve the Spider FX catheter from its storage place. Wet the surface of the catheter with heparinized saline and flush the recovery end of the catheter through its distal tip until fluid passes from the capture wire exit port and all air is removed from the catheter. Load the recovery end of the catheter onto the capture wire and advance. Keep the capture wire stationary. Carefully advance the catheter, observing under fluoroscopy, until the distal radiopaque marker on the catheter is aligned with the proximal marker on the Spider FX filter. Recover the filter using the partial or full recovery method. For partial enclosure recovery, gently advance the catheter over the filter until the filter gold marker is within the catheter, closing off the mouth of the filter but leaving the distal portion of the filter outside the catheter. Withdraw the catheter and capture wire as a unit, being careful to not interfere with the site of intervention, and remove from the patient. If resistance is felt, advance the filter and recovery end of the catheter distally, and draw the filter more fully into the catheter before attempting to withdraw. Use caution when using the partial recovery method to withdraw a full filter through a deployed stent. For full enclosure recovery, gently advance the catheter over the filter until the entire filter is within the catheter, leaving only the distal floppy tip of the filter outside the catheter. Withdraw the catheter and capture wire as a unit, being careful to not interfere with the site of intervention, and remove from the patient. Please refer to the instructions for use provided with this device for complete indications, contraindications, cautions, warnings, and comprehensive instructions for use of this system.